Good day. Let's take a look at the new UltraCI Glaucoma Early Risk Assessment module. Early detection of glaucoma is challenging. The signs can be subtle, making them difficult to detect. Ganglion Cell Complex asymmetry analysis categorizes the risk of a patient developing glaucoma. UltraCI Glaucoma Early Risk Assessment module can help to identify patients who are at the greater risk of developing glaucoma. It can also help to decrease the number of false positive referrals and increase the standard of care by supporting the early diagnosis and therefore time and treatment that will improve the patient's prognosis. Let's see how it works. So glaucoma can cause thinning of the ganglion cell complex, GCC complex, either in superior or inferior hemispheres. Therefore, we take into consideration two parameters: thinning in superior or inferior hemisphere and the asymmetry index, which shows correlation between the superior and inferior regions. And based on these variations in thickness between hemispheres, UltraCI calculates and displays glaucoma risk alert. For this particular patient, we can see the ganglion complex analysis of the superior hemisphere gives an average thickness 82 nanometers and the inferior hemisphere has an average thickness of 99 nanometers. The asymmetry index is 0.83 and UltraCI platform analysis indicates this as high level of glaucoma risk. Generally, three levels of glaucoma risk are available on the platform: the high level of glaucoma risk with noticeable difference in thickness and the high degree of asymmetry, medium level of glaucoma risk, not necessarily clinically significant, but further monitoring is recommended, and the lower level of glaucoma risk with acceptable parameters. For more detailed analysis, we overlaid an 8x8 grid on the 6x6 mm macular area, and asymmetry analysis compares each grid area in a single hemisphere of one eye with corresponding area in this opposite hemisphere. So let's take a look. This particular cell 0, 0 corresponds to this one, 7.0, and we can see that in this inferior hemisphere thickness is thinner for minus 5.7 micrometers. So here we compare and evaluate the difference in thickness between correlating areas of superior and inferior hemispheres within the macular zone. Please note that for the quantitative assessment of GCC thickness, it is necessary to take into account the presence of exudative changes in the macular zone of the retina and evaluate the GCC thickness data in a fellow eye. If there is a pathology that is causing significant disaggregation to the retinal layers, then the glaucoma module will not be able to analyze the layers to return an early risk analysis. Okay, I hope this was helpful and see you in our next tutorial.